Welcome back to another edition of No Shave November. I'm Pat Osterman.
And I'm Dr. Tim Biagini with GastroHealth of Illinois.
We want to welcome you back as we bring cancer awareness to everyone's attention during the month of November. And talking with Dr. Tim Biagini. Doc, what kind of cancer you want to talk about today?
I'm going to talk about pre-esophageal cancer and ultimately esophageal cancer, Pat. So it turns out that you can kind of think of it as breast cancer is to women, as esophageal cancer is to men. Men with acid reflux in particular, that being heartburn, some people dyspepsia, meaning pain with eating, indigestion, not even nausea or vomiting. Nonetheless, men are at risk for something known as Barrett's esophagus, which is a pre-cancer to esophageal cancer. Now, women can still get this just the same as men can still get breast cancer, but understand that most of it is men that get it. And someone like me, a gastroenterologist, is the one that would ultimately perform an endoscopy that would help diagnose this condition, either Barrett's or even esophageal cancer. Even in this Macomb area in the last month, I've had 2 men with cancer where your esophagus basically meets your stomach. Now, the other type of esophageal cancer is one that's more associated with tobacco use. It is known as squamous cell carcinoma. But as far as the 2 different types of cancer, the one that is by far the most preventable is adenocarcinoma, which is also, we think, at least usually has Barrett's as a precursor.
So a lot of what people may think are scary terms, but something that's very treatable and something that you can do really right here in this room. Right
here in this room. Basically, we can perform an upper endoscopy where the camera outside my pinky, we tickle the back of your throat, and then we go down, or I go down, and I look at the cells where your esophagus meets your stomach. Now, something that's exciting is many people have heard of pap smears for women. So men in particular, but hopefully the entire population, but for sure men will be able to swallow a pill that's got a string on it, and it will deploy in your stomach, and then you will take the sponge, if you will, out of the mouth, and it will just get little scrapings or superficial lining of the esophagus, and then we can send it, just like a woman when she gets a pap smear, we can send it to the lab here, and they'll hopefully be able to look at the cells and tell us if you have precancerous or, God forbid, even cancerous cells. But unfortunately, that's not mainstay just yet. It's up and coming. But for right now, the best way to think of it is to get an endoscopy to get checked. And that's still technically the gold standard.
So Dr. Biagini, is it more of an age concern for men? Is it more of symptom related for men when you're doing your screenings?
Yes, so both play a role, but certainly symptoms are what we pay the most attention to. Usually it is middle-aged men, but I will tell you I've had men of all ages, even in their 20s and 30s, with Barrett's esophagus, which is again a precancerous type of condition. But esophageal cancer, by and large, as a diagnosis, is usually men middle to later ages, say 60s or 70s.
So as we're talking No Shave November, we got a comment. Your beard, you're looking pretty distinguished there,
yes,
Dr.
thank you. It's getting a little bit of a gray to it. I see you have some too.
I do have some gray.
Yes.
Yep.
Yeah, a little more stress in life, perhaps. Maybe some more birthdays.
I joke with that, and family members will do that.
Yeah. But yeah, more distinguished. I like that.
But we are having fun with these No Shave November videos. We hope you enjoy watching these and also hopefully learning some things about cancer awareness. So we want to thank Dr. Tim Biagini for joining us today.
Yeah, thank you, Pat. I appreciate it.
For Dr. Tim Biagini, I'm Pat Osterman. Thanks for watching.